into it. The dye will highlight the path of the fistula. Your provider needs to know the pathway of your fistula in order to determine how to treat it. They will classify your fistula by its pathway. Yeah, that's all.
Okay, so can you tell us about the different types of annal fistula?
Okay, healthcare providers classify annal fistula by where they are located in relation to your annal scapular muscles. These are the muscles that control your bowel move. It's important to protect them. Your provider might refer to your annal fistula by a specific name based on its location, such as interfectoric annal fistula. Passes through your internal annal sphincter muscle and then burrows out through the space between your internal and external sphincter muscles. Transfixatoric fistula travels through both layers of your annal sphincter muscles. Suprasphincteric fistula passes through your internal sphincter and then goes around your external sphincter. Extrasphincteric fistula goes around both sphincter muscles. This less common type usually originates from your rectum rather than your anus, so it doesn't come from an anal gland.
Okay, so what's the treatment for annal fistula?
Most annal fistula will require surgery to fix. Spontaneous healing is usually requiring infections and abscesses that reopen the fistula. However, if your fistula is caused by inflammatory bowel disease and isn't infected, it will occasionally heal with medical treatment. Your provider might try treatment with an immunomodulator, right? Like infliximab, before resorting to surgery for these fistulas. Surgery. An annal fistula surgery can be simple or complex, depending on how simple or complex fistula is. The most common annal fistula are simple interfectoric fistulas, which only involve a small amount of muscle. These are safe to treat in a single operation. More complex fistulas may need surgery in stages. If your annal fistula involves only a minor amount of muscle and doesn't have any branches, it's considered a simple fistula. The surgical treatment for a simple fistula is called a fistulotomy. This one and done procedure is the easiest and most effective way to treat an annal fistula. Second one, fistulotomy. Your cultural surgery will out through the roof of the fistula, allowing it to fill in from the bottom up. They might also remove infected tissue, cutting through the roof, maybe cutting through a small amount of muscle, but a little is okay. Cutting too much muscle risks damaging your bowel control. Third one is complex fistula. Your fistula is considered complex if it involves a significant amount of muscle, if it has branches, or if you have pre-existing conditions that raise your risk of of complications from surgery. Complex fistula may require multiple surgeries to fix your correctional surgery. May use one or more of these techniques. Seton drain. A seton is a type of surgical thread that isn't absorbed over time, but must be removed a surgeon loops the seton through your fistula to help keep it open long. Be removed enough to drain all the danger discharge out. A seton can also slowly cut through the fistula tract, allowing the tissue to heal as it cuts through the muscle. Lastly, it helps with local scattering of the tissue so that the wound doesn't pull apart later. Your surgery may remove the drain and close the fistula with a fistulotomy or another procedure. If your fistula is caused by a chronic condition like a inflammatory bowel disease, your surgeon might leave the seton drain in place ineffective. Endorectal advancement flap. This procedure avoids cutting into the loop of the fistula, so your effector muscle stay intact. Instead, your surgeon cuts out the infected tissue along the inside opening of your annal fistula. Then they cover this opening by pulling down flap of healthy tissue from the inside of your rectum above it. The fistula should continue to drain out of the outside opening and then begin healing from the inside. How this procedure is considered about 70% effective, but in some cases the infection and the fistula still come back. Therefore, there are also still some risk of injuring the effector muscle when cutting the flap.
So, what are the risks of annal fistula surgery?
The main risks are reoccurring infection. If the infection inside completely gone from your fistula, it may continue inside your healing fistula. Antibiotics can usually treat a reoccurring infection. Reoccurring fistula and annal fistula may come back after surgery if it doesn't heal completely. This might be because of underlying chronic conditions or because of all the technique used. Fecal inconsistency. Some people experience slightly compromised fecal contents.
So, what is the recovery is like from the fistula surgery?
Okay, and annal fistula procedures are generally outpatient procedures, so you can go home the same day, although some people will need to return for more surgery later. You have prescriptions, paid medication to take home with you, along with some instructions for self-care. This may include water and fiber supplements. Pain medications can cause constipation, so your provider might prescribe fiber supplements. To prevent this is important to take this with loss of water.
So what should I expect if I am suffered from the annal fistula?
Your outlook you depend on how simple or complex your annal fistula is. This determines how extensive the treatment and recovery process will be. In general, you can expect to spend 3 to 6 weeks recovering from one or several surgeries. Some fistula retain surgery, especially if they had many branches or they were caused by a chronic condition. Some people with IBD get multiple annal fistulas.
So when should I see my annal provider for annal fistula?
Okay, always see a healthcare provider about annal pain. Unusual conditions that cause significant pain may be serious. Don't assume it's something that will go away by itself. Hemorrhoids may be more common and familiar, but they aren't usually very painful. If in general practitioner tells you it's hemorrhoid but the pain continues, see a specialist like a genetologist or a cardiac surgeon.
So what can you say about the anal vaginal fistula?
Okay. A perianal vaginal fistula is usually called a rectovaginal fistula because it usually connects from your rectum to your vagina. Your rectum is the part of your large intestine that comes just before your anus. The border between your rectum and vagina is much narrower than between your vagina and anus. A vaginal fistula can develop from any part of your intestines, but it's usually from your rectum or colon.
So what's the difference between the annal fistula and vaginal fistula?
An annal fistula is a split or tear in the lining of your anal canal. It can cause similar symptoms to an annal fistula, but a fissure is a superficial wound. It doesn't channel through your anal wall to your skin the way a fistula does. However, it's possible that a anal fissure could develop into an anal fistula. If an anal fissure become infected, it could form an abscess, which could create an anal fistula when it drains.
So what can be your last words or anything about advice to the audiences about the annal fistula?
Severe anal pain can be both physically and psychologically debilitating. Not only does it hurt you every time you sit or visit the toilet, but it may feel like a difficult thing to discuss with a healthcare provider. Don't let this stop you. Anorectal diseases and conditions deserve the same attention as any other. An annal fistula needs treatment, and the sooner you get it, the simpler that treatment is like to be.
So I would like to extend my deepest gratitude for having you in this interview. So for the listeners, this is now the end of our episode for today, whereby we were with the health expert and we were discussing about the annal fistula. But don't forget to like, subscribe and drop your comment, as well as to like our YouTube channel. Until we meet again, bye bye.